Hi, this is a like the follow-up sort of video about my past PET scan, the procedure, and what happened afterwards. So last week on November 22nd, something like that, I forgot the date, I finally made myself through calling a couple of places and getting people to work, which is really sad because patients shouldn't be doing that. It should be natural for office oncology office to take care of that, but apparently that was not the case. And I'll go through this to explain what's happening there in case if you're dealing with the same people and the same attitude and the same problems. So anyways, I'm there at the College Hospital Wrigley Center nuclear department to do the PET scan. And just to explain the procedure, it's a radioactive sugar. It's the sugar plus some radioactive elements they literally pump into there, and they inject it intravenously into your veins, and that takes 1 hour to circulate entirely, like from head to toe, and whichever areas are cancerous, it's gonna basically light up, which is what the machine reads, the scanner reads. Okay, so I'm there. I had my injection, no side effects, very effortless. Like you don't even feel like any different. It's not like the sugar water that you drink. They make you drink, and sometimes some people have really bad reaction. They start vomiting. No such thing. This is very civil, very organized place, and so you get this injected, and then you're waiting for an hour to have that circulated through your entire system, and then they call you for the scan, which they did. They called me for the scan, so I'm done. The scan takes, you have to lift up your hands, and you're laying in this basically look like an MRI machine, but I don't believe it's an MRI machine. I could be wrong. Anyways, so they scan you. It's about 20 minutes. It's a little lengthy, but 20 minutes, not a big deal. So then they basically tell you that you're done, and your results will be available through, if you have an online patient portal, through that after the doctor reviews or after some days. So they were not clear if I'm going to get the answer right away or I'm going to get the answer after the doctor reviews that, etc. So, and then right next day, 2 days after that was Thanksgiving. So I honestly did not expect to get the answer. So it's been like, even up to now, I don't have the answer, which is like kind of irritating because the doctor's office, they already have the answer. I called the Wrigley Center to find out if the results are there, and they are not calling me to give me my results, which is like ridiculous. Like if you're a cancer patient, you're literally waiting for your results to find out if your cancer had spread or not, etc., etc. And oncology office, silence. And so I found a workaround. I requested my information through because this is Sansom Clinic, requested my information, and the lady was very nice. And I did tell her that I have an upcoming appointment with a different specialist, which is true. And just to have a second opinion. So she asked me, when is my appointment? I said it's in 2 days, and she promptly gave me she told me to get back to her around 2 o'clock, and so which I did. I received my data. the report and as well as the imaging on written burnt on the DVD. And so my results are not very clear. There are a couple of nodules on my axillary, which is like in this region on the left side that flared up. They have the SUV, which I'm not sure what it stands for, but it says that it's about 7, which is pretty high number. But in my cervical area, which is really interesting, and I'm not a specialist, I don't know much, so don't hold me against anything. Like, okay, it's in my cervical area, their findings were absolutely non-existent, and like as if I don't even have cancer, which I'm really surprised because I know these machines are not very sensitive, so they cannot read too much, but that liquid that I had, the sugar water, radioactive sugar water, glucose, should have already shown something. Anyways, that's a question to my doctor, which I'm gonna talk to her after I finally got through insurance jazz and back and forth calling the office. Office doesn't know if I need an insurance because it's outside of my network, etc., etc. I finally got that I can have a follow-up with my surgeon, with my oncologist, just oncologist, and she's also the surgeon that's gonna do the hysterectomy. And so I finally got with her a follow-up so we can discuss the results. And this is coming from me. They never called me to follow up, to do like a follow-up appointment or anything. One thing that I missed to mention, I'm sitting there at the PET scan waiting for that 1 hour to roll by, and I receive a call from the oncologist office saying that they have a cancellation of a surgery and they would like to fit me in for the next week Wednesday appointment. I'm like, you gotta be kidding me. This is a surgery. I'm not like taking somebody's cancellation just because, it's a pretty major surgery. It doesn't work that way. And I'm surprised because I also talked to the doctor and to the surgeon, and she did say we're gonna do the PET scan prior to scheduling you for any surgery. She didn't say go ahead and jump into the surgery and without looking at the PET results. So I'm really puzzled if this is coming through her, or is this coming through her employees that are trying to put a show that they're doing something, because they have done lots of errors so far in my book. And I actually called their manager and reported them for this many problems. So yes, she's telling me that, and I tell her like right away. I'm like, no, this is not what we agreed on, doctor. My surgeon is gonna actually look at the PET scan results, and we can go from there on. So anyways, she's like, okay, this is what I'll pass it to the doctor. Like, doctor knows already why you're passing it to the doctor, right? Okay, so anyways, again, frustration, and then finally have my follow-up appointment, and I have millions of questions. Like, I have a hysterectomy. Is that gonna be it? Am I gonna be cancer-free afterwards? Or what procedures I have to go through? How many? What's the date? What's the date? What's the recovery period? What's the what do I expect? Because she told me that there's a chance she would take the lymph nodes out of my sides, so they don't get any they don't transfer anything. If she removes my lymph nodes, then am I gonna have excess water in my tummy all the time? Like, how is this gonna work out in a big picture? Also, if again, am I gonna be cancer free afterwards, or this is gonna be like test after test each year? I gotta go to some bogus places and find out that you missed something. or do I have to go through radiation or something? A million of questions. I have actually 20 questions that I keep coming up with new questions every time, because you want to find out prior to going to the pretty major surgery. And is she gonna remove both of my ovaries, or one? She did tell me after examination that one is, the left side of mine is a little enlarged, and it is pretty achy. I feel that ovary is always bothering me. Is that gonna be removed, or it's gonna be kept? If it's removed, am I gonna go through the hormonal therapy, patches, estrogen, etc., or it's gonna be just your body will handle with just one ovary, or it's gonna be both of them out? So I don't know. Lots of questions, as you can tell. Yeah. So I'm gonna be reporting after which is December 7th is my appointment. You would think like it's a cancer, they would promptly schedule you in for the quick follow-up. It's gonna be like, yes, 10-15 questions, but it shouldn't be taking 10-15 minutes, right? So, but no, they schedule you 2 weeks forward, which is another thing, like, thank you. So anyways, my struggle is continuing with in professional people dealing with this, and just like it's really difficult. It's really tough on people. It's really tough. I admit cancer patients are not the most happiest ones, because you have this scare, you have these questions, you have like million things of going through your brain. And so, but this office and people are just confusing like heck. They don't know how to operate. I don't know how the insurances work. Sometimes they tell you go get a referral for your follow-up appointment, and then they say no, you were already established, you don't need the referral. Then the third day they call like, oh, we got the authorization, so you're okay with the appointment. It's like, oh my god, people, call the insurance, talk to them. Don't let the patient deal with this. Find out and then proceed, so they know what to do. Jeez. Anyways, this turned out to be more complaining video than actual, but yeah, that's what I'm dealing with right now. It really sucks, but oh well. Talk to you soon. Bye.